And good morning, everyone. My name is Mary Ennis, and I am the Outreach Coordinator for Seniors NL. I want to welcome you all to this week's Let's Talk. And today we're going to be talking about the Remote Patient Monitoring Program. Our weekly Let's Talk or Just Ask sessions, because we do alternate, um, are supported by United Way, Newfoundland and Labrador, and we're very grateful to them for that support. I don't know if we would be able to do this every week if it wasn't for them. And before I go on, I just wanted to cover a few basic um, housekeeping items. I'm slow this morning, aren't I? Anyway, if everyone would keep your mic uh, muted to block out any kind of background noises, because we do get some of those. And we don't want to listen to anyone's radio playing or dogs barking this morning. If anyone wants if anyone wants the words to what we were saying written up on the bottom of your screen, just press CC, the closed captioning button at the bottom. And if you have any questions or comments, I'd really appreciate it if you put them in the chat box. And at the bottom of your screen, again, you'll see a little icon for chat. And then you can put your questions or comments on the bottom, the right-hand bottom of the screen, okay? And after the presentation is over, I will pass the questions on to our guest speaker for response. And well, as you know, the session has been recorded. It will be up on YouTube by tomorrow for sure, okay? And one last thing, if anybody out there would like us to have a session on a particular topic that's important to them, by all means, let me know, and we will see what we can do. And before we go on, I want to take a few moments to do our land acknowledgement. We respectfully acknowledge the land on which we gather as the ancestral homelands of the Beothuk, whose culture has now been erased forever. We also acknowledge the island of Tamaguk as the unceded traditional territory of the Beothuk and the Mi'kmaq. And we acknowledge Labrador as the traditional and ancestral homes of the Innu of Nutatsin, the Inuit of Nunatsiavut, and the Inuit of Nunatukovut. We recognize all First Peoples who were here before us, those who live with us now, and the 7 generations to come. As First Peoples have done since time immemorial, we strive to be responsible stewards of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in a spirit of truth and reconciliation to make a better future for all. Thank you. The Remote Patient Monitoring Program connects you to health services and resources that best suit your situation. And this program is about helping you and your family make informed choices about dealing with chronic illnesses. And today's speaker is Kimberly Ghaney. And Kim is the Regional Manager of Virtual Care at Eastern Health NL. She's a registered nurse with a vast experience in delivering patient-centered care to people living with chronic conditions in various institutions throughout North America. As part of virtual care innovation, Kim leads the Remote Patient Monitoring Program, which is a technology-enabled self-management program that is designed to educate, support, and empower patients living with chronic conditions. And Kim is also an active community volunteer. I don't know where she gets time, but she serves on the municipal council, and she's also chair of the school council at her children's high school. So without further ado, I will ask Kim to put up her slides and start her presentation. And once again, questions or comments in the chat boxes. Thanks, everyone.
Thank you, Mary. Good morning, everyone, and thank you very much for having me at your session today. I have a few slides and a couple of short videos to share with you around remote patient monitoring and the patient experience. All right, let me just get those up here. I will warn you, I am in Holyrood and it's pretty stormy out here, so I do hope that we don't have a loss of power either. Okay, let me just make sure I'm sharing the proper one here. All righty. Can somebody confirm if you can see my screen?
All's good.
Yep, all good.
Thank you.
All good.
All righty. There we go. Okay, so the Remote Patient Monitoring Program is an innovative program to support active self-management of patients with select chronic conditions at home, enabled by simple technology. Our initiative started in 2015, and that was supported by Canada Health Infoway through some startup funding, as well as the Department of Health at Newfoundland and Labrador government, and with support from the Newfoundland and Labrador Centre for Health Information. The Remote Patient Monitoring Program and team use technology to provide education, support, coaching, and monitoring of patients living with select chronic conditions. The core team consists of 4 registered nurses with vast amount of experience in patient care, an administrative assistant, and the team carry caseloads of 70 patients and upwards. The program also monitors patients from areas outside of Eastern Health. Initially, in the project phase, the patients were confined to Eastern Health region. But as the program grew and needs were identified in other regions and the success was demonstrated, we spread into Labrador portion of the province. Our first attempt there was in Black Tickle, where we monitored patients with COPD and diabetes. Then we started in Western Health as well as Central Health with patients who were awaiting cardiovascular surgery, who had diabetes and needed some extra support in optimizing their condition prior to surgery to improve their outcomes. The Remote Patient Monitoring Program is a part of the government's Way Forward Chronic Disease Action Plan. And given that our region has many remote and rural areas, this type of technology and programming allows access to real-time health information, which can help manage chronic disease and have some level of equity throughout the province. Patients can have more access to support and care, education, and coaching around managing their condition. They're provided with devices that allow them to measure their blood pressure, oxygen, blood sugar levels, that kind of thing. And that information is transmitted to the registered nurse who will help coordinate the care with the patient. The eligibility criteria has changed since we first started this program, but primarily for the core program, and I will explain a little bit more what I mean by that. The patient would need to have a confirmed clinical diagnosis by a physician or nurse practitioner, be at high risk for hospital utilization, and be able to use the technology, which is quite simple to use, and have access to internet through Wi-Fi or phone line, cellular, sorry. But as we've grown the program and integrated into other program areas, the eligibility criteria is determined by the program area. This gentleman you see there on the right of your screen was one of our first heart failure patients, and he made the comment that the best part of the program was that it bridged the gap between his visits with his cardiologist. He was able to reach out and have questions answered from his nurse, who was partnered with him throughout the duration of this program. Patients are identified for referral to remote patient monitoring through a variety of sources, from acute care units at hospitals, physicians, nurses, allied health professionals such as social workers or physiotherapists, and self-referral. So if a patient has the diagnosis that we monitor, such as COPD, heart failure, or diabetes, they can call up the program and refer themselves as long as we can confirm their diagnosis. So healthcare professionals, and in the case of the core team, it's comprised of registered nurses. They use a platform to provide self-management support, behavior modification, education, and support, which ultimately empowers the patient. We know that in acute care, in the emergency setting, there's not a lot of education that's provided due to the nature of the area. It's very busy units, and patients are already under stress from being admitted. So it's not the most effective way to deliver education to patients. So the nurse contacts the patient to follow up on any data of concern and provide coaching and education and intervention. And part of the program is doing medication reconciliation, which is a review of the medication that the patient is on, to ensure there are no duplicates, that it is exactly what the doctor has ordered, that it's being taken as it was recommended, and to also look at if there's any contraindications. And looking at the coaching and the medication around medication compliance is really important in helping patients arrive at positive outcomes. Taking medications properly is extremely important, and we've learned that a lot of patients haven't had a good education around how, when, why to take their medications. So the health coaching is a very large part of the program. The program is called Remote Patient Monitoring, and the monitoring is of course important, but the health coaching is probably the most important part of the program. It empowers patients by improving their knowledge of their disease through education, and the education is delivered in a variety of ways, through the slides on the devices, through coaching calls with the nurse, and through the educational library that's embedded in the iPad. It reinforces health information that's provided by patients' care providers. When the programs were built, we worked closely with our partners in chronic disease who helped with the way the education was scripted and delivered so that all the messaging was consistent. No complications there. And also it educates primarily on nutrition, medication, exercise, anxiety, and smoking cessation. And there's a fair bit of goal setting that's part of the program. And of course, we include family and caregivers where possible and where appropriate. So when this program was rolled out in 2015, obviously we wanted to have significant benefits both to the patients and to the health care organization. And for the patient, the goal to them is to increase knowledge of their disease, improve their ability to self-manage their disease symptoms, recognize symptoms early enough so that they can act on them early and prevent severe exacerbations or flare-ups in acute episodes, and decrease travel to access healthcare services while maintaining optimal wellness at home, and ultimately to improve quality of life. And for the organization, obviously the highest cost healthcare dollar is around acute care and emergency and ICU and that kind of thing. So if patients can be managed, can manage their conditions, appropriately at home and safely at home, then that is the best place for that care to be delivered. So the remote patient monitoring actually improves access to care by having the technology in the home with access to a registered nurse or other healthcare provider. These are the devices that we use in the program for monitoring of patients. And as I said, currently the core team monitors patients with COPD, chronic obstructive pulmonary disease, lung disease, congestive heart failure, and type 2 diabetes. This is just a quick video to show you what a health session looks like from a patient's perspective. It's one of our team did this video to show how simple it is for the technology to be used. We tested this, hopefully it does work. There is no sound, so it's just a short video on taking you through the program. There is the ability to video conference directly from the nurse's dashboard to the patient's iPad, so that the patient has this iPad in their home or other device. The nurse can place a call to the patient to have a coaching call or to do a further assessment of any symptoms that the patient may be having around shortness of breath or something like that. And so the measurements taken by the blood pressure cuff and the other devices actually appear on the iPad and is stored in with 30 days worth of data, so that if you wanted to, you could take your device to your physician visit or your nurse practitioner visit and share your measurements with them so that they can see the trending. We do send trending documents to the primary care provider, but this is another way to share the information with your provider. Then it goes through a series of symptom questions that would be related to the measurement. All the directions for taking measurements are embedded there in the iPad through the health session. So you have the ability to, the devices are Bluetooth enabled. So as you can see, the measurements transmit, excuse me, to the iPad itself. But you also have the ability to enter information manually. Some patients prefer to use their own devices, and they can enter that information in there so that we can see it. As you can see, there are videos embedded. We didn't want to show them during this demonstration because it would take a little bit too long. So it takes you through some education even as you're doing your health session around, for example, with lung disease, different types and color of sputum. And the questions are specific to the condition that's being monitored. So you wouldn't get questions around Lasix or diuretics if you were enrolled simply for COPD. This is more of a demo tablet today. And there you have it. That is the health session, and it took 4 minutes. As I mentioned, the nurses have access to a dashboard where the information comes. These are some demo patients that you see here. Excuse me. So when the nurse starts her workday, she'll see, you know, certain measurements there that will give her an indication of who needs to be contacted first. So as I mentioned, the nurse contacts the patient around any measurements of concern. So there are individualized thresholds set for each patient. So as everybody knows, my blood pressure is going to be very different from yours and from your neighbors and from your husbands or your wives or what have you. So the thresholds are individualized to the patient's baseline. So for this demo patient here, it looks red, and that means that the measurement fell outside that person's baseline. So it's red, it's probably low. And that will be an indicator to the nurse that she should contact this patient around their measurements that morning. This is just a trending graph. This is the type of document that we send to the primary care provider to show them how the patient is trending with their condition. So for example, this person, I mean, the blood pressure looks absolutely quite good overall. So it's trending and had a little dip and then it went up. And so it gives the primary care provider an idea of how the patient is trending. This must be a patient with COVID because we're monitoring temperature. So it's been up and down, but that information is sent to the primary care provider. So we send the trending documents to the primary care provider on a monthly basis or on request from the primary care provider. On certain occasions, the primary care provider may adjust blood pressure medications for the patient. And rather than having the patient have to come back into the office in 2 weeks, 3 weeks, 4 weeks time, they can reach out and get the blood pressure trending report from the program so that they can make a decision if the blood pressure medication is therapeutic, if it needs to be adjusted, and it saves patient travel. The physician or nurse practitioner is also advised that the patient is enrolled in the program and is sent a final summary report on completion of the program. And I may have failed to mention, but the duration of the program is 4 months for COPD and heart failure, and it's 6 months for type 2 diabetes, with the ability to extend if the patient hasn't reached their goals. These are just some statistics that I wanted to share. Basically, it shows you the types of patients that we are enrolling. On the bottom part of the screen, there are the core patients, the core group patients. And as you can see, COPD is the front runner in the number of patients enrolled. And this data is accurate up to the end of December of 2020. Diabetes type 2 is quite high, and then followed by heart failure and the comorbid conditions or the people who have two. Maintenance, you'll see maintenance program is a 2-month extension program that we put in place for patients who were a little bit more challenged in reaching their goals and needed some additional support. So at the end of their 4 or 6 month program, we have the option to roll them over into the maintenance program for that additional support. It's much more patient driven, it's much more independent, but they still have access to the registered nurse. And these areas up top here are areas that have integrated the technology into their clinical practice, which is the goal of remote patient monitoring, to have clinicians and existing programs to use the technology to support their patients in how they practice, how they augment their care. So for example, there's an inspired COPD program at Eastern Health. They've enrolled 27 patients. The home dementia program through Eastern Health, which is a provincial program, have enrolled 26. And Western Health, congestive heart failure and chronic obstructive pulmonary disease, Labrador Grenfell Health, diabetes, and the Eastern Health Congestive Heart Failure Clinic. So it is growing. There are many other areas that are looking at integrating the technology into their practice, but this is just a quick snapshot of how it looked as of December 2020. This gentleman was one of our most successful patients who went through the program, and I should say that we do have permission to share their stories, the patient stories that are in this presentation. Mr. Bolt lived in Grand Bank. He has severe COPD. He wasn't sleeping. His quality of life was quite poor compared to how he previously was. He struggled a lot with going out to church and Tim Hortons and those types of things because he was coughing so much and he was so short of breath. He was in emergency departments sometimes 3 times a week for nebulizer treatments for his COPD because he was so short of breath. And when we spoke with Mr. Bolt, we understood very quickly that the biggest challenge with him was that he wasn't provided with a lot of education around his medications and how to use them. So his nurse spent quite a bit of time with him at the beginning of the program, educating him on his inhalers, on Action Plus COPD Action Plan, which is using steroids and antibiotics to treat flare-ups, and activity tolerance and those types of things. And by the time the program was up with Mr. Bolt, so the 4-month program, he was doing so much better. And in the 12 months following his enrollment in the program, he did not have to go to Emerged one time for shortness of breath for his COPD because he understood how to manage it, and he was more active. He was working in his greenhouse, he was working in his garage, and he was actually going back to church and out on outings with his wife. His story is really quite remarkable. He couldn't sleep unless he was sitting up in a chair. And I mean, his final statements there is that the best part is when I go to bed now, I can go to sleep and I can breathe better. And, you can't ask much more than that. But he really, he really invested in the program. He had a lot of family support and he just did beautifully with it. And his story is really quite a good one. Not everybody has the same level of change as he does, but people do experience a lot of change and improvements by by participating in the remote patient monitoring program. Excuse me. Some water there. I have a video to show you about a patient experience, and I'm hoping this works for us. Sometimes it takes a moment or two to load.
My name is Joy Williams. I'm 61 years old. I've been living with diabetes for about 20 years and I've been insulin dependent for the past 5. My osteoarthritis developed to the point where I started walking with a cane. I wasn't able to play with my granddaughter. That was really terrible because she's a very important person to me. Somewhere along the line, I had to take a big lifestyle change.
In Eastern Health, we have an aging population and many patients have more than one chronic disease. In order to support those patients' chronic disease, we have to have innovative solutions to reach them in their community. Access to service is challenging because of the rural geography. Providing service and health services to them where they live is really important.
It's probably the biggest, I would say the biggest innovation going on now in virtual care in the patient's home. You can be anywhere in the province and get the same standard, same level of care. That's one of the big things.
The Remote Patient Monitoring Program is an innovative program that uses technology as an enabler to provide coaching, education, support, and behavior modification, as well as monitoring for patients with chronic disease. Joy really embraced the program. She really embraced the education that she was receiving through the iPad, and she really linked in with her nurse.
Depending on my answers to the questions would be prompt whether I would get a phone call from my nurse.
The program is teaching people how to self-manage their own care, their own disease.
The daily monitoring and teaching you all the skills that you need to better get a handle on your chronic disease is what makes the program so successful. It was really comforting, I guess, to me to know that somebody out there was going to help me through this.
They can recognize symptoms very early, act on them earlier, and prevent an ER visit or an admission, which is a very high cost to the system. It certainly decreases travel for both the patient and the clinician, and it can decrease the number of visits that a patient has to have. Since the implementation of the program, we've seen a 13% reduction in ER visits.
She always used to say Nana has her walking stick, and when I stopped using it, she was so pleased. Nana, she said, you're learning to walk without your stick. So that made me really happy.
It's really important for Eastern Health to be part of the Access 2022 movement. The use of digital health solutions is the way of the future if we're focusing in on patient care.
So Joy, in this video, Joy has actually become our patient partner um, in remote patient monitoring. Sorry, I don't want to play that again. She's been really valuable in partnering with us. She worked with us on our patient forum that we had in 2019. She works with us on our document development, on our survey development, on improvements with the program, and she's just been an amazing partner with our program. This is some more data around the patient experience from the remote patient monitoring program. And it just gives a picture of the benefits that patients are experiencing through the survey that's embedded in the program. So 2 points during the program, patients are delivered a survey around their experience with remote patient monitoring and with their health coaching. So as you can see, patients are really very satisfied with the programming and the support that they receive from their nurse. They feel that this is, the patient perception, but they feel that they have less need to go to their doctor, to go to the emergency department, that they're more informed about their condition, and that their quality of life has improved, which is so very important. The satisfaction with the health coaching is almost always hovering around 100% when we look at it. The patients have a strong sense of collaboration, I guess, with their registered nurse who they're assigned to at the start of the program, who takes them through and is really their partner in reaching their health goals. They also indicate that there's a fairly significant amount of time saved in traveling both for themselves and their support person in accessing healthcare to see a healthcare provider. So it definitely adds up over time. As you can see, some people, 5 people, for example, in Q3 felt they saved more than 10 hours in travel. That's really quite significant. 14 felt that they saved 6 to 10 hours, and 10 of their family members saved travel. So it's really quite significant. When this pandemic of ours started last year, the remote patient monitoring program team developed a program to monitor patients with COVID-19 who would be at high risk of complications from the infection, which allowed patients to safely isolate at home while still being monitored and supported by a healthcare team. So part of that is that we brought nurse practitioners into the program as well. They were deployed to us to support patients whose care need to be escalated outside the scope of practice of a registered nurse. And that's worked out quite well. In Newfoundland, until recently, we were quite fortunate in that we had lower cases of COVID-19, but it's very beneficial that patients can safely monitor at home. We know that there's a high level of anxiety when someone is diagnosed with COVID-19. So the amount of emotional support that is provided to the patients in their own home while they're safely isolating and monitoring has been really beneficial to them. We've received quite a bit of good feedback from patients who've been able to monitor at home and still have access to healthcare. And this is just a very quick picture of what's happened over this year since COVID-19 entered our lovely little province. So we started out at that first peak back in April with 16 enrollments and very little over the summer. And then, of course, since the start of February, we've had 40 patients enrolled to the program. And you can see the comment there in the bottom right corner. The patient felt, patients often feel very isolated because of this condition, having to self-isolated. So they felt like they weren't left alone because they had that connection with the nurse, and they were very grateful and appreciative. So what's next for remote patient monitoring? A big focus of healthcare, the Department of Health, Eastern Health, and so on is mental health and addictions programming. And there's been funding allocated from federally for that. So our next big project will be to see where virtual care, where remote patient monitoring fits in mental health and addictions programming to improve access, reduce wait times, those areas of need for patients where technology can help. We're looking at adapting the technology for other purposes. So for example, with the COVID-19 acute care unit, we've taken our devices and put them in that unit so that it allows the patients to measure regularly and reduce the exposure for staff. Ongoing integration to existing clinical practice, which I mentioned earlier was the mandate of the program, to have healthcare teams use the technology to support their practice. And there's certainly been a need for that over this past year and obviously into the future. We're looking at partnering with other programs and organizations in innovative projects, such as with diabetes long-term outcomes and so on. We are looking at a further integration of the data into electronic health records and the electronic medical records, so that all of your patient information is integrated and available to the circle of care healthcare providers, and using the chronic disease registry to target patients who could benefit from this service. And this is just a quick slide to show you that we partner with a lot of different organizations around the development of the program, around development of all the programming content, the education, coaching methodology, resources, and so on that we share with patients. So it's been really invaluable. As you can see, Seniors NL is there. We connected with them early on when we were developing programming. And, these other ones as well are so very important. The Lung Association allows us to use their educational videos. Heart and Stroke Foundation partners with us in getting information out to patients. And there are so many more. And that's probably not even a complete slide, but it's been very, very beneficial. And with the support of the department and Canada Health InfoWay and the Center for Health Information, it's been a very successful 4 or 5 years. So that is the end of the presentation. If you have any other questions, we're available through our email address or our phone lines, and can answer any questions around the program, content, how to refer yourself, et cetera, et cetera. And we're always happy to answer any questions you may have. So if you do have any questions, I'm happy to answer them. So thank you very much, everyone.
And thank you very much, Kim. That was great information. I just have a few stats here, a few different stats, actually, that I'll share with you. When people registered for this Zoom session this morning, we asked them 4 questions. And the first one was, have you heard of remote patient monitoring? There were 51 people who registered. 16 of them had not, but 28 had heard of it before. So that's all good.
That's good.
Yeah, we asked, have you or anyone you know, do you use virtual care? 24 people said no, they don't, but 24 people said yes, they do. So we do have some users already, which is great. And the third question was, if you don't use virtual care now, would you? One person said no. But 35 said yes, and the rest didn't. I guess the rest were maybes, I would say. So I just wanted to share that with you. And I do have questions, quite a few, but we do have a bit of time left here. Let me see. First of all, is remote patient monitoring available to people living with cancer?
Not currently. It isn't something that's on our immediate radar. It is very important, obviously, cancer care. If there's a need for it, and I'm actually going to be sitting very soon on the virtual care advisory committee for cancer care, which I'll be having my first meeting with them in March. So who knows, maybe it will in the future, but definitely I think virtual care in some way, shape or form will be required with the cancer care.
Thanks, Kim. Another question is, what are the financial burdens for participants in the program? Is there any cost associated with the program for participants?
That is a great question, and something that was very important to us when we started is that there be no cost to the patient, like zero cost. The thing that we really wanted to think about when we first started is the differences in socioeconomic status for people in this province is very varied, and oftentimes the patients who need this program are the ones that probably don't have access to a lot of funds. So there's no cost. If you don't have Wi-Fi in your home, we cover the cost of the data through 3G cellular connectivity. And we even provide extra batteries in case the batteries run out in one of the devices. So we don't want there to be any cost at all to the patient to participate and manage their care.
And that's a plus all the time. I've still got questions coming in here on the side, and I've got questions in my hand. Oh my goodness.
That's excellent. I love questions.
Yeah, good. Okay. This is, I guess, or a comment. This would be a great program for those on opioid treatment. And also cardiac rehab has been limited during COVID. Any comment on that?
Absolutely. And you're going to be thrilled to hear, whoever answered that question, that some of the mental health and addictions funding that we received for RPM is intended to go towards opioid treatment. So that's on the immediate radar, which is great. Cardiac rehab. No one has approached us around cardiac rehab, but it's certainly, it's very related to congestive heart failure. And I could see that there would definitely be a benefit. And I do know the nurse who runs the cardiac rehab program. So who knows? We'll see. I can certainly reach out and ask her if she's got it on her radar.
Yeah. And another question, which is not surprising, is the expansion of this program in any way limited by funding?
That's a really good question. So right now, in the areas that we're targeting, the funding is more than adequate. We have, adequate funding to monitor and manage and support the patients who need it, because as you may understand, the technology is rotated through, right? So you're not constantly purchasing technology. So when you're finished with it in 4 months, it's sent back, it's resanitized, it's wiped of all information, and it's repurposed and sent to the next person. So the technology is sent out. What I will say is, obviously, when you're targeting new areas such as mental health and addiction, there does have to be additional funding allocated, and that we have seen that happen because the different levels of government have recognized the value. So I would say right now we are not limited with what our targets are, but if we were going to spread further, there would probably need to be additional funding.
Great. I'm not sure if you can answer this, but is there a home dementia program available in Western Health?
So the home dementia program is managed through Eastern Health, but it is a provincial program. Yeah. So I do know that Dr. Butler, he is the physician responsible for the home dementia program. He has plans to expand provincially. They're taking it in baby steps, much like everybody should, simply because it's new technology and sometimes there's glitches and they're working through their workflows and that kind of thing. But his intention, to my understanding, last time I spoke with him, was that it would be expanded provincially.
Yeah, that question was from Wanda. Wanda, if you want, I could send you contact information for Dr. Butler. Just let me know. Okay, what is Inspired COPD?
So you might want to have Ashley on to talk about that, but Inspired is a program for COPD that's it's a model that came out of Nova Scotia, and it's expanded to a number of different provinces across the country. It's ran by a respiratory therapist normally involves home visits from the respiratory therapist before the pandemic. And they look at, it's very, very similar to the COPD program through remote patient monitoring, but with a little bit more focus on advanced care planning and the in-home visits, the in-home physical assessments. So since obviously with the pandemic, it limited the ability for the RT to go into the home. They actually reached out to us to use the technology. So they have been able to continue with the Inspired COPD program using the technology a little bit in a different way, but still able to offer those services. And it was previously limited to St. John's and surrounding areas, but because they're now using the technology, they're able to offer it a little bit more widely. But they're still in a pilot phase, I believe. So I'm not sure what their capacity is at this point in time.
One of our lead thorns, one of our 5 lead thorns, is asking if you've had any feedback from home dementia families so far.
No, I have not. That is something, like I said, they're relatively new. I think they started first back over the summer and with, very slow steps. But I haven't seen their results, but I could certainly look for them. There might be something there now, although they're longer term. So I'm not sure if they would have had any surveys delivered to them yet. I'll check that though, and I'll let you know, Mary.
Okay, great. Yeah, and I will have to let the lead thorn know. Think of all the lead thorns. If you put your cursor over the box on the side where there's a lead thorn and go up, just put your cursor over there, and on the top right corner, you'll notice 3 little dots. If you click on that, you can rename, you can put in your actual name. That would be really helpful. Anyway, okay, next question. Does the program work with pharmacists as well? When you're taking a lot of medications, it is so hard to keep them straight if you don't have a pill dispenser.
That's a really good question. So we don't have any official linkages, we'll say, with pharmacists, but our nurses do recommend that patients, if they have a lot of medications, and many of our patients do because they have a lot of different conditions, if there's any question as to the efficacy of the medications, or if there's any contraindications there, that they would recommend that the patient go and have them reviewed with their pharmacist as well. But the pharmacist and the nurse has access to the Healthy NL viewer, which I'm not sure if you know what that is, but all of your medications will be in there to be accessed. So part of the medication reconciliation that the nurse does at the start of the program is to go in there and look if she sees, and I keep saying she, and I do have 2 new male nurses, so I should stop saying she. She or he will actually recommend that the patient reach out to the pharmacist as well and let them know of any problems with how their medications are there. And sometimes they're in the viewer in a way that the patient's not taking them. So there may be something like Lasix is in there twice a day, and then furosemide is in there twice a day, and they're the same drug, but one's a generic name, and so they may be taking too much. So it's that kind of thing that the nurse will look at and then refer to the pharmacy.
Great. Okay. Moving right along. I'm assuming Central Health supports this as well. How do you get access to the program? And if the patient spends winters in St. John's and returns to Fogo in the summer, if someone has this life routine, can they change location?
So Central Health hasn't adopted it yet as integration into their existing clinical practice. The presence that we have in Central is for patients who are waiting cardiovascular surgery, who have diabetes and need that optimized prior to their surgery. So I am working with Central Health right now, and we were actually in the midst of discussions to start rolling it out in their congestive heart failure program, but we got sidelined by this latest spike. So So yeah, that seems to derail some plans. But yes, it's definitely on their radar, and they are very interested in pursuing it, but they're not quite there yet.
Okay. And it's certainly well open to people with diabetes. We know that.
Yeah, and the geography piece is not a concern as long as you're staying within the province. So if you are on Fogo and you're there for 3 months and then you go to St. John's for 9 months or vice versa, there should be no reason why you couldn't continue with the programming while you're in either of those locations because it's all remote.
And now I have a few comments here. Actually, I do have another question. When will the interaction be face-to-face and not delivered via a private phone? This feels uncomfortable.
I'm not sure what you mean.
Yeah, and that was a question. I don't know who asked that, so I can't ask them to elaborate.
Well, primarily when there's an issue that needs to be followed up, it is done by phone with the RPM core team. I'll just speak to that, and maybe that will answer the question. If not, maybe the person can ask again. The video conferencing is available. We do find sometimes patients aren't comfortable with that. So the default, I will say, is by phone. But if you were on the remote patient monitoring program and you wanted a video conferencing call, then you would just have to tell your nurse that.
And I'm sure that certainly when we're through with COVID, that, I'm assuming that patients will be able to see their healthcare provider face to face.
Yes, well, yes. I think virtual care will always be a component of healthcare, but you can't replace hands-on assessment. So, nobody should ever worry that virtual care is going to take over the world and we're never going to have face-to-face. But obviously, it has to be done safely. So anything that can be done by virtual care right now, I believe, is. The hands-on assessments are so very important, and that's why the PPE is so important, that we have that available for the people who absolutely have to have the hands-on assessment.
Yeah, exactly. A few comments. I'm aware of the remote patient monitoring program, and I hope to be able to connect seniors with this service in my new role as Seniors Wellness Navigator. I don't know who that is, but maybe I'll go digging around to find out. I am interested in the virtual care program. I'm unsure of its involvement, but I do have chronic health issues and do virtual doctor interviews as part of my care during COVID period.
Good.
And someone else says about your video, great video. The program fits so well with the health report. And that's all the, everything that's going on, all the consultations around the health report.
Yes, that's exciting.
Yep. Oh yes, I'm hoping that there'll be positive changes,
Yes.
Let's see. Another comment up on my screen. Sounds like a great program. If we could only get our government on side with making it financially feasible to stay in your own home. That's an exit. There's a note here. Hi, Mary. I am the Seniors Wellness Navigator, and it's from one of the Lee Thorns. So we have so many Lee Thorns. It's really interesting. Yeah.
Hi, Mary. This is Lee number 1. I'm really sorry about that. It must have had to do with the link that we sent out or something. Maybe it originally was emailed to me. But if people want to go into the participant list, they can change their name by clicking on the little blue button and typing in their actual name. Yeah. So sorry, this feels so strange here today.
This has been very helpful. Thank you. Oh, I've got another Lee Thorn coming up. Maybe. Oh no, sorry. Oh yes, another. Oh, okay. Maybe this is our Lee Thorn. Seniors and all Lee Thorn. We are each responsible for our own health, but we all need lots of support to keep up with lifestyle changes. Words of
That's so
wisdom.
very true. So very true. And that and the lifestyle changes are the most important part, really, understanding what lifestyle changes need to be made and not to tackle them too quickly that you get overwhelmed, right? So it's about the baby steps and goal setting, reaching those small goals and building on them. And that's what the nurse really tries to take you through.
Yeah, absolutely. That's all the questions we have. Although if now Kim has committed to sharing her slides, so she's going to send me the slides and I will send them out to everyone. And by tomorrow afternoon, this session should be recorded and up on YouTube. I will also be sending you the link to that. And just a few other things, and I did ask this on the registration form, but if anyone's forgotten, if you attended this session as part of your job-related personal development or as part of your post-secondary education, we could send you a certificate of completion. Just email me, and that's my email address there on the bottom. And so that would be great. We'll send out a certificate. And coming up next week, we'll have Elizabeth Siegel. Elizabeth is the Director of Information and Referral Services with Seniors NL, and she knows everything. And if she doesn't, if you ask her a question, a hard question, she doesn't know it, she'll find an answer, get back to you, okay? So think about any questions you want to ask about programs and services for seniors, about issues. Any of your questions, just think about it and join us next Tuesday for that. And coming up after that, we have a session on advanced care planning. And I'm hoping that that's going to be an interactive session. And anybody, if you need anything, if you have any questions about anything, you're always welcome to give us a call, okay? And like I said at the beginning too, if you have any ideas for sessions that you'd like us to do, let me know, and we will see what we can do. So thank you, everybody. Thank you, Kimberly. That was fabulous. And I wish all of you a very good week, and please stay safe. Goodbye, everybody.